Hello, in this video I'm going to talk about the clinical case summary assignment. This assignment is worth 150 points, and so it makes up a rather large part of your grade, so it's important that you do a good job on all of the different components. One of the things that I often hear students say is, well, I plan to become a behavior analyst, so I don't need to know about research design methodology. A course in single case research design really isn't that important. The purpose of this assignment is to get you to see your role as a scientist practitioner. And even as a behavior analyst in practice, you should be using single case research design with your clients to determine if interventions are effective. And then also, it's important to have a good understanding of single case research design as you are reading through journal articles to determine what is best practice given a referral concern. One of the things that I want to point out about this assignment is that you need to complete each of the 10 components in order to obtain credit. And I debated having this assignment due as one cohesive paper at the end of the semester, but I thought that it would be better to break it up and allow you the opportunity to work on different components throughout the semester so that it's not so overwhelming, and also so that you can get feedback throughout the semester. I figured that that was important because this material is new for most of you. Failure to submit any of the components is going to result in a score of 0, so you must submit all 10 components of this. For this assignment, you're going to pretend that you are a clinician who has been referred one of the 3 case examples below. And so you can pick any of the scenarios. You're going to work on this same scenario throughout the entire semester. Because keep in mind, I really had planned this to be one cohesive paper, but decided to break it up into parts. So you can choose either scenario 1, scenario 2, or scenario 3. For every week, you're going to indicate which scenario you're working on. And remember, it's going to be the same one. So if you pick scenario 3 during the beginning of the semester, then anytime that you complete one of the clinical case summary components, you are going to use scenario 3. So the first part of the clinical case summary is to identify the scenario and the problem. So you should list the scenario that you selected. It's okay just to say scenario 1, scenario 2, or scenario 3 as long as you match up the number correctly. And then you're going to state the problem. So this is your primary referral concern and the area that you will target. And this can be something as simple as one sentence, like Jenny engages in high rates of self-injurious behavior. Keep in mind that Jenny is not in this scenario, and so this is not an appropriate problem identification for any of the scenarios given. The next component you should start working on from week 1. It is not due for a couple of weeks, but this is one of the largest components. So you're going to select an intervention or interventions that address your referral concern. In order to do this, you are going to need to consult the literature. You are going to find 10 empirical articles from peer-reviewed journals in support of your selected intervention or intervention components. You cannot use review articles. You cannot use theses and dissertations and meta-analyses. These will not count toward your 10 article requirement. However, if you would like to include a review article or a meta-analysis, theses and dissertations are never acceptable, but a review article and meta-analysis, you can include them, but then you would need to find 10 other empirical articles. You should list all of the articles in APA format in a reference list and number them 1 through 10 or 12 or 15, however many you have. You just must have at least 10. And then you're going to go into Blackboard and complete a chart that includes the following information about each article. So you should list the article and make sure that it's identifiable. If you've numbered your articles, you can simply put the number in your chart. I know that it's hard to include a lot of information in a chart. I want you to identify in your own words the research questions, the number of participants, list some of the participant characteristics. For example, perhaps the participants were four Caucasian teachers with master's degrees in a public school setting. You should list the independent variable. Remember, that is the intervention, or the dependent variable, which is the outcome variable or what was measured. Identify the design that was used, and your articles should all use single case research design. Uh, Post a few bullets about the primary findings, and then identify some of the limitations. And keep in mind that you should not simply regurgitate the limitations from the authors, but you should try to come up with your own limitations given what you know about research design. This is more time consuming than you think it's going to be. So what I would suggest doing is maybe in week one, find your articles, and then each week thereafter, uh, focus on doing the summary for 3 articles or so until it is due. After you have identified your intervention, you are going to identify your research question. So this is the research question that you are going to evaluate. So for example, is X intervention effective for decreasing Jenny self-injurious behavior? And you would put in X, whatever the intervention is that you found. So is a token economy effective for decreasing Jenny's self-injurious behavior? You might also look at whether a combination of 2 interventions are more effective for addressing your referral concerns. So is the combination of verbal and graph performance feedback effective for increasing treatment integrity? Is graph feedback alone effective for increasing treatment integrity? Or is the combination of graph feedback with verbal feedback more effective? So you are simply going to write a sentence about what the research question is. And your research question in clinical practice is going to relate back to whether or not your intervention is effective for your referral concern or to address the problem. After that, you are going to identify and describe the dependent variable. So the dependent variable, again, is the outcome variable. This is what you are measuring. You should provide a thorough description of the dependent variable. You need to have sufficient detail so anyone can understand how to measure your outcomes. So for example, if you were evaluating a reading intervention, you might use correct words per minute and errors per minute. And you would need to describe what an error is and how to record correct words per minute versus errors per minute. Then you're going to identify your measurement system. So you should describe how your data will be collected. Will you be using momentary time sampling, partial interval recording, whole interval recording, frequency recording, duration recording? How are you going to collect your data? I then want you to collect a data sheet that would create a data collection sheet in order to collect your data, and then describe how you will calculate inter-observer agreement given your measurement system, and how you're going to train your data collectors. One of the things that you should do is specify a training criterion. So do they need to demonstrate 100% mastery criterion before they're able to independently collect data, or is a 90% training criterion adequate? But make sure that you describe in detail what that training looks like. Then you're going to identify and describe the independent variable. So the independent variable is your interventions or intervention components that you selected. You should provide a very clear description of the independent variable so that anybody can replicate what you're doing. Describe how you're going to implement the independent variable. What will it look like when you are administering your intervention? And again, there should be sufficient detail so anyone can understand how the independent variable should be implemented. I should be able to pick this up and know that, okay, if I chose scenario 2, this is exactly the procedures that would be used. I anticipate that this could take you a page or two in order to do adequately. Then you're going to identify the research design. So given the scenario, the number of participants, and the referral concern, you're going to select the research design to answer your clinical research question. You can simply state, we are going to use a multiple baseline design across settings. And then you're going to provide a brief 1 to 2 paragraph rationale for selecting this design. I think that you'll find your textbook to be helpful and some of the other articles that you are assigned for each design to be helpful in helping you to understand why this design is a good design for your research question. The other thing that I want you to do then is list 2 other designs that you didn't select and describe why you didn't select these designs, but perhaps they could have been appropriate. So oftentimes, given a research question, there's more than one way to answer your question. And so you will want to list those other designs and just say why in the end you chose the design that you chose. After you have your design, I want you to create a mock data set and graph your data. So your mock data set and your graph should look like the design you selected. So if you chose a multiple baseline design, your mock data should fit into a multiple baseline design. Your graph should include all phases of your study. You are not going to run the study, you're not going to try it out with anyone, but given what you know based on the scenario and the intervention that you selected, the literature supporting your intervention, you can make up data based on what you expect to see. Your graph must have several elements. So at some point you must show variability in responding. You need to show an immediate change of high magnitude, an increasing trend, overlapping data, and then consistency across 2 or more phases. And I need you to label each of these on your graph using a text box and an arrow. During the next week, you are going to provide a visual analysis. So you should write in paragraph format a visual analysis for your data for level, trend, variability, overlap, and the consistency of results. You might also talk about the immediacy of change and the magnitude of change. This should read similar to what you would read in any research article that uses a single case research design in the results section. You should calculate the mean, median, and range for each phase, and make sure that your description is in paragraph format. However, your book has a table that can help guide you in your visual analysis. You can use that and you can include it in your paper, but you should also have it in paragraph format. Again, similar to what you would read in the results section of an article that used a single case research design. So in the final phase of this project, you are going to evaluate your data. So based on the visual analysis of your made-up data, provide the next steps. What are you going to do? Are you going to switch the intervention? Will you modify the intervention? Are you going to add a component, remove a component? Are you going to keep the intervention in place? Make sure that you explain your rationale. If you choose to keep the intervention in place, make sure that it's feasible, right? Sometimes we have to implement an intervention at, say, a dosage that is not feasible to maintain in the long time, and so we have to pull back, right? We might need to thin the schedule of reinforcement and work on getting control based on the environment. So this, in summary, is a synopsis of your clinical case summary. Make sure that you leave more time than you think. Let your instructor know if you have any questions. There are no examples for this assignment because it is a new assignment this semester. However, your instructor can likely point you in the right direction of finding materials. That's all for now. Thanks.